So a huge thank you for everyone's participation today, speakers and also the questions from the audience. It's been so interesting and I've learned a lot. I've learned a new word, kenotic. I didn't know about that before, so thanks Chris if you're still here. And I've also really deepened my understanding of adultification. I think that's one of my main takeaways from today. I've learned lots of new things that we can apply to a family hub context. So we'd also like to hear, what some of your key takeaways are as well. So at some point there'll be a Mentimeter up on the slide. So I think you can just if you want to, you can just go onto the Mentimeter website and just add the code in that will come up and be able to comment on any takeaways that you've got from today. And on the theme of takeaways, for this plenary, the government sponsors who you've heard already today, along with Sam and Tom from the DFE and DHSC respectively, will talk about some of their takeaways that they can take back into their government departments. But before we do that, I would like to welcome Dina Koschorreck, who's our Parent Participation Advisor at the Anna Freud Centre, and our CEO, Professor Peter Fonagy, at the Anna Freud Centre as well. So I'd like to start with their reflections, and then we'll move on to hearing from the government sponsors, and then we'll use the rest of the time for question and answers. So over to you, Dina.
Thank you, Gloria. I'm Dina Koschorreck. I'm a Parent Participation Advisor at the National Center for Family Hubs, and I'm also an adoptive parent of 2 teenage girls, and they've got complex needs. And a lot of what's been said today resonated with me, starting with Josh McAllister, who said just putting people in the same building doesn't necessarily bring the desired effect of integration. I'd go even further, that even putting them in the same room doesn't necessarily bring integration. I think integration is a real chance for holistic care, and that's, I think, what's needed. What I see is a lot of cooperation, friendly exchanges of information, but in these large meetings that we as parents with our young people have occasionally, or quite regularly actually, what I see is often there's a lack of clear leadership, there's a lack of clear structures, and Joe Flanagan mentioned both, but there's also often a lack of clear goals. So if I can give 3 examples from my family and people I know. We have one very vulnerable family member who's in care, and at some point there were, I think, 12 professionals involved, and they had a meeting, and her foster carers felt that everybody stayed in their line. Nobody really took on the leadership of that meeting, and so in the end, nothing really moved forward. Or even worse, we have another family member who at some point had some substance abuse problems, but also, based on mental health issues. And then the professional who was dealing with the substance abuse problem said, we can't do anything before the mental health problems are resolved. And the person who was responsible for the mental health said, well, we can't do anything before the substance abuse problems aren't resolved. So these issues between services really need to be resolved, I think, and I think if integration is done well, then that's a chance to do that. And these are expensive meetings, and I think the goals need to be clear. They need to be communicated to the young person. They need to be communicated to the parents so that they can think about it. And in terms of leadership, who should be the leader and who should decide on the goals. And I think that should be the families and the young people, and they need to be enabled and empowered to take this leadership. And I think that's an opportunity to really raise young people who have lots of challenges, but who feel that they can do, that they've been enabled to make choices, that there are choices, and that they're not done to, that therapy is something where they're supported in their journey, and they're not told what their goals should be. And I think we really have to think about, what's all our identity in these meetings. Yeah, I think we're all sort of here probably have a bit of a savior mentality. We feel good when we're helping people, but and that's, we need to give up of that. We need to hand that power over to the young person and give them the feeling that they can solve their problems. We'll be there for them, but we believe in them. And I think that's, on the one hand side, scary, particularly for me as a parent, because not all choices have been good choices in my family. I think we really have to be self-critical as well and sort of look at the power structures that are involved there, and our egos, and reshuffle all of that. Yeah, and I think I'll probably, my 5 minutes, are they over, or I can talk? Okay. Then I think it's integration and participation sound expensive, and I think at the beginning they involve more work, but I do think that integration is actually a chance for making services more cost effective, reduce workloads, and create a smoother experience for service users. If I can give an example from my family, I have one daughter with chronic pain. Last September, her pediatrician and I agreed that a certain medication would be good for her and that she should be referred. The pediatrician couldn't prescribe that medication. She was transferred or referred to a specialist hospital for children. My daughter's 16. 2 months later, the hospital refused the referral, said she needs to go to adult services. Then we waited 3 months for the referral for adult services, tons of emails, phone calls, no, she's not in the computer, yes, no, she is in the computer. Then we had the appointment. Now we've been waiting 5 weeks for the typist to write down what was decided in that meeting and to be sent to our GP. So we have now almost May, and in September basically everything was clear, but because there is no integration and nobody really knows what the left hand doesn't really know what the right hand is doing, that's half a year, and that's half a year my daughter has been in pain 24/7. And so I think this has meant extra workload because of the phone calls and following up and send the referral again. It's been a negative experience for my daughter, of course, and I think that's where integration could be really valuable. And then I'd like to make a final point. It's we've been in meetings where I've shared my experience. We sort of think about modules we are going to tackle, and I talk about what I think from a service user's point of view, what's going to be important, and then we meet with the government, and then the government sort of talks about what they find important, and it's really difficult, or almost no, it's not almost, it is impossible to see where those two approaches actually meet. There's sort of this top-down approach and the bottom-up, and somewhere the top-down turns into policies, and it's very, very difficult to see how it actually filters down, but of course it does. And I did a bit of a Google search, and it's interesting because in research people talk about top-down approaches and bottom-up, but that these often go together, and how we bring them together. Well, I don't know. I mean, maybe I should have Googled more, but I didn't really find anything. So I would encourage everybody to think about that, how we can match those two up. Thank you.
Thank you. That was very enlightening, particularly the bit about not being able to match up the top and the bottom. I think we have all experienced similar things. But what I want to talk about just for a few moments is the advantage of what you touched on, which is co-production, doing things together, designing a system together, which is one of the advantages of starting something relatively new, not totally new, but relatively new, and how you get policymakers and families and young people as well as those who are delivering the service, into the shared task of designing something that works, and what the advantages of that process are as you create something that's relatively innovative. So there is something incredibly valuable about shared ownership, which is when you co-produce, you have collective responsibility for something. You invest in something together and feel that it's yours, which in the human mind makes you, I think, relate to that entity that you've created in slightly differently. But also that collaboration could ensure that family hubs are designed to meet, and that's what I heard a few times, that needs are unique, that you can't put a shape on the need of an individual or a family, and the different kinds of experiences that people bring to a family hub or a problem need a configuration of services that suit that particular individual, that particular family, and that is what a co-developed, a co-produced service can achieve, that flexibility. But I think also decision-making that's informed by policymakers, but also the regulatory requirements and the policy objectives that come together in the way exactly as you were suggesting, with the needs of individuals. And that is very hard to achieve, but if you co-produce, it should happen. And I think I'm really talking about a user-centric approach, so that when you were talking about that the young people should be at the heart of the service, families should be at the heart of the service. But I think involving the families to design the service as you are being involved, I think allows us to make choices about what are the right priorities in any context. That actually creates increased effectiveness and a successful and sustainable family hub. I want to talk about just two more things. I've actually got 12 points, but I don't think I'm going to use all 12. But I just want to say two things which I personally feel are really important and touch on the points that you raised. The first is trust, enhanced trust that comes from transparency, because the way the human mind and the human brain works, when we do not trust, we hear, but we don't listen. And services often do not trust the people who come to them. And often the people who receive the services do not trust the people who are providing the services. And with that absence of trust, there is no communication, no transfer of knowledge. Because in order to believe somebody, to change your behavior, because of what you heard, you need to have trust. And I do think that co-production can generate that trust. And I think one final point touches very much on what you were saying. And that is perhaps the most important component of trust, which is empowerment. And you used the term. And you used the term in terms of young people needing to be empowered. To me, the current narrative that we have about young people is negative in an imbalanced sort of way that sustains stereotypes, that force them into roles that are unhelpful and counterproductive. And also some families are forced into negative stereotypes. because of the lack of empowerment. If we have not a view of, say, mental health as a crisis that we need to address, but something that perhaps is reflecting a changed society where we have taken too much power away from young people and from families, and where we have to start as our first step returning that power back, enabling families, young people, to take control. And I think that was the phrase that you used. That is the beginning of a healing process, because there is no mental health problem that I know of that's not associated with a loss of agency, a loss of feeling that you are in control. So if we're going to address the crisis, which I don't believe in, we have to start by giving people agency, giving people control, not just responsibility without agency, which I think we are doing to some degree at the moment. So thank you very much for listening.
Thank you, Dina and Peter, for so eloquently bringing together themes of co-production, trust, empowerment, power, and agency. So if we just have some final comments from Rob, from Kirby, and from Kim, and then we'll also have some comments from Tom and Sam.
I prefer to keep on listening to you two, which I think is a lot more interesting than anything I'm going to say, but fascinating. So 4 things from me. Firstly, family hubs are, I think, this amazing opportunity for healthcare, well-being, and how do we get the voice of the NHS, the voice of charities which are supporting people's physical and mental health, the voice of public health into that conversation. I was really interested in the conversation that people are having around adolescence, and a lot of our focus is often on the first 1,001 days for very good reasons, but I think that's a real challenge to think about how we're supporting younger people, not just in a negative context, but positively supporting their mental health, their sexual health, physical activity, and other things like that. A really fascinating conversation, I think, today around trust and leadership and some of the inherent tensions in that. So I was struck by the idea that actually we need to give power away to other people, particularly young people. And that was a bit of a challenge to me. And also we need to share our power and authority with people in other organizations, with other viewpoints, with other priorities. And if we're going to enable our staff and our colleagues to do that, then they need to have a certain level of psychological safety. They can't be too knackered, they can't be too burnt out. They need to be able to engage and have broad horizons. And so we need to be able to support people through workforce development and other methods to allow them to be in a good enough place to actually do that work. And there's a tension in leadership. You're talking about the need in certain situations to have a clear sense of direction and people not taking up the reins to do that. But we also need to share that leadership responsibility across systems and with other people. And how do we do that? And that's a new model of leadership, I think. One of the fun things, if that's the right word for it, in the COVID pandemic was that you could pull a lever and actually something would happen, stuff would actually get done. And that was a bit of a buzz. It doesn't always happen if you're working in a statutory environment or in a charity, I'm sure. But actually we need to have this shared model of leadership. And when is it right to step forward and try to take lead, and when is it right to step back and listen to what other people are prioritizing? I think this sort of event is fantastic because you do get that face-to-face contact with people, which I think is absolutely vital for building trust between different people. That top and bottom thing, I mean, I work at a regional level. Danielle in an earlier session was talking about the importance of integrated care systems. There's something about the meeting place between national and local frontline, and how do we make that work. In OHID, we're trying to balance service delivery with policy. I can't pretend that we always get that right, but we are trying to be that kind of junction where the top and the bottom can meet. Thirdly, there was a lot from the get-go about the evidence base and how important that is, and making the case for family hubs. And so I really hope that one of the things that we're going to be able to do is evaluate what we're doing and get that sort of approach to shared outcomes that could be really exciting, and a way for us to prioritise as a system. And lastly, I think there's learning from family hubs for the rest of the system in terms of integrating better. So I'm sitting here with my esteemed colleagues from different departments, and actually I don't work with them very closely, and so I think that's a challenge to me to learn about what their priorities are and how that can be supported by public health, and how the new system that's evolving around healthcare and social care, integrated care systems, new models of delivery, how we actually do that above the level, if you like, of family hubs, so that we're walking the walk as well as talking the talk. Thank you.
Thank you very much, and thank you, Dina, for sharing your story. Your description of what you want services to be like is my principles of whole family working. So apologies, it's not currently happening, but we are definitely trying to get there. 4 quick points. The first one's very similar to that. Really enjoyed today. Lots of different aspects of family hub delivery in the room, and I think what I'm taking away is just how connected everything is, and how I need to redouble my efforts to join up with colleagues. We already work really closely across government, Best Start in Life team, Family Hubs team, Home Office. But actually we need to go further, I think, and we need to make a lot of these connections come alive, and we're committed to that. It's been really good for me, for the Supporting Families programme to be here, but I can see how we need to play our part in helping things join up. The second point, which has come up today from a few talks, partly the talk about the pandemic and faith groups, but also our colleague from Westminster, is my view as a family hub manager is actually a new role, or it's a recreation of a role. It's a blend of children and family expertise and being a community development worker. It's actually very akin to community development, going out, finding the needs, putting groups together, putting new services on together, being a real neighbourhood entrepreneur that can really bring everybody together. And as I used to work in neighbourhood renewal, it's so exciting to see that work coming back. But I think we do need to recognise it's a different skill set, and perhaps it's not had the profile that maybe it had back in the day. So I'm really, really excited to see that happening. The third thing is a positive, I hope. I realise the fiscal environment is difficult, but look, we've just got family hubs money into 75 areas. We've got the Best Start in Life money. We've got an uplift in most areas on the Supporting Families programme. We've got 2 years of stability on a level from a civil service perspective until the next spending review. So we've got 2 years of good delivery space in front of us. It's taken a while to get everything running, but let's use that 2 years to really deliver. As you say, let's make the case. We need a strong delivery on all these programmes to really show that we can rebalance children and family services away from the acute end, and we can go back to the Treasury with an argument for further investment. And my fourth and final point is that Blackpool families rock. So thank you for that as well.
So a couple of things that I've noted down quite frequently today is people saying it's not easy. It's actually really hard to do. So definitely hear that feedback. Things that stood out from the session that I was on, I think the parent-adolescent relationship being key focus. I heard some really great things about detached youth work from Tim, and considering things about embedding things where they're working already is definitely something we also hear. Wouldn't it be good if government are always good at doing that? But looking to if there's already youth boards in your area as well. And from Portsmouth, the education link, was really keen to note that. There's quite a lot of examples I'll be taking back to let my colleagues know about, and really heard the feedback on can we talk more positively about adolescents and teenagers, the things that we focus on in the Home Office. They sound more negative, don't they? The violence reduction units, despite their title, are doing some really great positive activities in early intervention from like a huge range of different things with children, as we heard about as well today. I think some of the thinking about what can we do for online, so gaming tools sounded really exciting, but definitely hear that about can we create more positive narrative is something that I'll be taking back to think more about as well. And then thinking about how we do that join up for what it looks like from a service user perspective. Definitely conversations that we have a lot constantly. How do we get better at doing that? How do we get better at seeing what it looks like for a service user and joining up all of the different provision that we've got, and then how we integrate the top down, bottom up, how we get better at doing that again. Definitely we'll be reflecting further on that. And other points, I think, from Josh McAllister, really heard the point about evidence. Really interesting presentation on adultification. Definitely got the message on co-creation, and I think investing in something together being a really good takeaway as well. Yep.
Thank you. Is it possible to have the roaming mic and pass that to Tom and Sam at the front here, please?
I just want to say quickly a quick thanks to the organisers and the speakers. We've had a huge variety of viewpoints. I think that's been really valuable. Lots of different disciplines and professions. It's been genuinely really good to hear the sort of more, I guess, kind of philosophical mixed with the theoretical, mixed with the practical, mixed with the, every kind of, ology and itical you can think of. And a huge amount of cross-pollination, so that's hugely valuable. A quick few takeaways for me that I've taken from this conversation. I mean, one particularly interesting one I think is about the idea that you have to kind of change someone's mind before you can change their actions. So the kind of primacy of cultural change, really. Thinking about the importance of creating a broader sense of collective consciousness across an organisation or different organisations. So, going back to that point about kenotic leadership, basically kind of giving up some control, emptying oneself in order to kind of build better partnerships with others. Obviously underpinned by a lot of effective training, leadership, that kind of thing, debate. But also, I think really importantly, the point made by Peter about that being underpinned by trust and by others being founded on respect and shared values. The sort of second observation is how that kind of cultural changes, has to be underpinned by sort of structural changes. So, we heard some interesting things from Portsmouth, for example, on finance, so how you can use kind of pooled funding and so on in quite innovative ways, and they've got a bit of history of doing that. Obviously things like data, so important kind of structural changes there, and lots of other things that perhaps I guess are things we talk about more often. We talk more about structures, I guess, than we talk necessarily about culture. So it was good to see today a bit more airing of the kind of cultural aspect of things. I also just wanted to mention the point about adolescence and the 1001 adolescence sort of period, 1001 days of that. That was a really interesting challenge, and I think something for us to go and sort of think about a bit more what that kind of looks like. I think whilst we're clear in a lot of the kind of documentation around the programs, the program guide, policy framework, such exciting publications as those, no doubt you've all read, they do obviously talk about service all the way through from 0 to 19, but I think it's fair that we need to sort of think about how we help local authorities to kind of best make that a reality, because it's tricky. And then lastly, you'll be glad to hear, just a point which I think echoes some of what Kirby said about kind of, it's sort of evolutionary change. This is all, Family Hubs is kind of part of a bigger kind of context in history, right? I'm sure many of this room have been kind of looking at these problems for a while. And ultimately what we do is we kind of make some progress with the resources and the opportunities that we have. And Family Hubs is a big opportunity. So it's one worth, grasping hold of, pushing forward as much as we can. And as Kirby mentioned, we'll be getting a huge amount of, hopefully, extremely high quality evaluation data out of this, which then we can use once these 2 years funding have passed along to make the case to our friends in the Treasury. We very much hope that, as I say, we can kind of get that high quality evidence, and then it's back to the pitch.
Thank you very much. I feel like I'm going to burst into a song, but I'm not going to do that. So I turn around because I've been sat looking this way all day and I haven't seen you all like this, so nice to see you all before you head off. So my name's Tom McCulloch, based in the Department for Health and Social Care, Sure Start Unit, and I lead a team of people in the Sure Start Unit who are working with local authorities to implement the Start for Life and Family Hubs programme. I thought I'd better mention Start for Life as well as Family Hubs, because it is really a joint partnership approach between DHSC and DFE, really. And some of the things that I've thought about today, really, it's been a really, really good day. I know Claude is going to thank people in a minute, but I want to thank as well everybody who's taken part, given their time, and people who've shared their stories and their testimonies. And I think I'm quite new to the civil service. I've only been there for 6 months. I'm seconded in from another organisation, and the team that I lead are all seconded from children's services backgrounds. So we bring a different perspective, I think, hopefully some added value to the programme. But what's been really good about today is that even 6 months in a government department, you can get a little bit away from the practice that you're familiar with and grown up with. So today's been really brilliant in bringing to life for me what Family Hubs looks like in development, implementation, and how you're taking it all forward. So that's been really powerful, and I think it's told me that we need to make sure that we constantly create opportunities for policy, government, programme guides. I'm glad you mentioned it first, but to think about what the practice implications are. So what does it actually mean on the ground? And I think today's really brought some of those questions to the fore. So how does this big idea, this big concept, this next 2 years, what does it look like in practice for families, really? I was going to mention something similar to Kirby when he said, we do honestly try and talk to each other in terms of government departments. So we work closely with DFE, but we also work really closely with supporting families, reducing parental conflict, lots of different departments trying to come together to reduce some of the burden on local authorities and providers trying to deliver programmes that might have a similar focus. So we are trying to sort of reduce duplication. The thing that I'm really sort of struck by today, really, is the focus on equity, inclusion and participation. And I was thinking about this, really. I mean, my colleague Beck here, just to embarrass her, she reminded me that we do say in some of our guidance, we meet families where they are, meet young people where they are. But I wonder whether we could have given even more of an emphasis to equity, inclusion and participation. So going forward, I'd like to think as a programme how we can really embed that and work with you to make that a reality. And the question I would have asked, if they came to me, so I'm going to ask you now, really, I don't mind. So, when the adolescent, young people stuff during the day has been so powerful to me, because I don't think I personally haven't really thought enough about that in terms of Start for Life Family Hubs. And I would have asked about young parents, because I really strongly agree with the point that people made. Young people are not one homogeneous, is that the word? They're not one similar group. They come in different backgrounds, shapes, sizes, histories. And obviously, how do we think about young parents in terms of Start for Life Family Hubs? So anyway, that's what I would have asked, and we would have got a really good answer, I'm sure. So I want to say thank you again to everybody for coming along. There's some really interesting stuff that I've learned today that I'm going to follow up. So if I haven't spoken to you, I might have clocked some of the things you're working on and follow up. If I have spoken to you, I'll definitely follow up with some of the things we talked about, really. So thank you again for the opportunity to be part of this, and wish you all a good rest of the day. Thank you.
Well, thank you so much, everyone on this panel, this final plenary. We've run out of time, so unfortunately we're not going to have the opportunity for Q&A now. But there is a feedback form, and we're able to kind of answer questions that you send to us afterwards, and all through our kind of usual channels of regional networks and webinars that we do, we'll be able to kind of respond and keep this conversation going, because it's been so useful, and I really hope that we really have been able to to kind of collaborate and learn in real time, and to make connections with people in the breaks and in lunch, I hope, and also to really think about how we can close that feedback loop between policy, practice and participation. So my final thought is that I have a lot of food for thought to go back to my youth worker friend with, the one that I mentioned at the beginning. So I'll be passing on some of the information that we talked about today. Thank you to our panelists. Thank you to all the Anna Freud team for doing this behind the scenes, to Al, the videographer, and Steve and Tom, our BSL interpreters. Thank you. Hope you journey so well.